So I think this is a good segue here because obviously you've done, I mean, a tremendous amount of work, not only with clinical work with patients, not only training residents and then future behavioral health consultants or behavioral health providers who work in integrated care, consulting with a variety of different organizations and systems. Obviously, you have a new book out, and my mind kind of is curious what you would say, you know, what is it about this book? I mean, what's new in this book? What perspective did you take in this book? And obviously, because you have a lot of writings out there already, what's new about this book that you have out?
What's new about this book is that instead of talking just about integrated care, I'm taking the perspective that integrated care is part of the forefront of successful and viable patient-centered care generally. And so one of the things that's happening in a lot of places now is that as teams work together, the behavioral skills that the BHC brings need to be transitioned or need to be a part of the routines of the team as a whole. And so it has seemed to me that first in the book, I make the case that we haven't been doing well with patient-centered care. We've been doing a lot better with the medical home piece, but not great with the patient-centered care piece. And so, I mean, the things that were asked for by the Quality Chasm report in 2001, like the patient is the controlling factor in their treatment plan, and they have access to all their information, those kinds of things, we still are not delivering on generally. And so I'm taking that, what would real patient-centered care look like? What would the team interaction look like? What would this look like if you were serving the most challenging to serve people? And those are folks who are, they're called complex in one literature, they're called disadvantaged in other literatures. Turns out a great many of them are called trauma victims in other literatures. But in each of the literatures, there's very little interpenetration, very little using what you learn in one approach for the other approaches. So I put that together in the book, and we come up with an approach that honors transparency, that we were, you know, talking in front of the patient is just a piece of thoroughgoing transparency in primary care. We're talking about empowerment, but empowerment using, as it's described in trauma-informed care, which is working from the strengths of the patient, working from what the patient already has, rather than offering the patient a list of stuff they're not doing well as a start. We look at activation and how you can use language in the interaction with the patient that anybody on the team can use, not just the behavioral health clinician, to help the person experience the self-efficacy they need to manage their own health. And in the end, we talk about mutuality, that how could we, in fact, have a structure, a basic structure to the building of a treatment plan that the patient was fully a part of without changing what everybody does. And so the book builds up to this sort of general approach, and does I think a pretty good job of showing what else is already out there. So it's not just saying you have to do it this way. But the idea is that primary care, if it were truly patient-centered, and if it was truly patient-centered for the most challenging, most folks with the most health burdens, could look like this. And it gives them a map there.
You know, Sandy, and I'm so excited for this, and I'm so excited for people to read this. You know, it's constant conversations that I'm having with our residents, and then also our behavioral health interns and fellows, and about this idea of like patient engagement, right? And it's like, hey, we can have all these great evidence-based interventions and evidence-informed interventions, and that's fantastic, but it doesn't matter if we don't have a context of engagement, if we don't have a context of compassion and grace. It doesn't matter what our interventions are, right?
That's right.
Yeah, so I'm really excited, and not to be corny as hell, but I just thank you for writing this book. It's one that is very, very apt timing. So let me ask